Dr. Kavita, and I'm the speech and hearing consultant for children and newborn. Now, in my last bulletin, I had discussed about the newborn hearing screening programs, and especially which has started recently at Bhagirathi Neotia. You may log on to Facebook of Bhagirathi Neotia for my detailed talk. This time, I'm going to discuss about the speech and hearing, speech and language delay in children. So we need to grow up now a bit. We see a lot of patients, lot of children and worried parents in our clinic with speech and language developmental delays and disorders. Now what exactly is this? A child not talking at appropriate age picked up by the parents or the pediatricians and brought in attention to the referring consultants. So when a child is brought to our clinic, I generally go through a checklist of sounds like the child responding to various environmental sounds, responding to name calling, waking up to loud noises, and then we do some assessments on the child. So if the child hearing is normal, then we move on to other causes of speech and language delays, like is it associated with other developmental delays? Are there any family history? Is it a male child? Because male children talk late compared to the female. And are there any autistic features? Has the child got hyperactivity disorders, autistic spectrum disorders, or ADHD? And then we rule out the causes one by one and we organize. We do the counseling of the parents and we organize speech and language therapy and behavior management therapy if needed for the assessment for the autism. Speech and language is a very, very common disorder. It occurs 1 in every 5 children and it's a lot of stress for the parents. So as an advice as a pediatric audiology consultant, whenever you see a child with speech and language developmental delay, please refer them for the hearing assessment. If the hearing is normal, then we look into the other causes of delays. So what you may think, why you may not do the, if the hearing is normal, you may also know that, parent may also know that the hearing is normal, but still what you need to make a referral, because if we do early assessments, we can do early interventions, especially in cases of children with hyperactivity problems. So early assessments, early intervention brings out a lot of better child. And if we do not do anything, the child may learn to talk later on, but then that gives a lot of problems with the reading and writing skills in the later school days. So in this talk, I mainly want to highlight about speech and language developmental delays in children. Children who have missed out the hearing screening, especially at birth, should have a hearing assessment done and should be referred early for early intervention and early diagnosis and early treatments. So thank you so much, and I hope this is helpful to you in your practice.